this is your first time at a dermatologist? Okay. For your first visit, I am going to be quite a bit more thorough. I'm going to have a lot of questions to go through just because I want to get a feel for your skin, your past experiences, what's worked, what's not, so that way we're not wasting any time trying things that you've tried before that just didn't fit your skin type. And it also helps me get a full picture because the health of our skin, it's not just what we put on it, it's also how we eat, how our gut health is doing. There's lots of contributing factors. So we're going to start off just by asking some questions just so I can get an idea. Okay. First, can I just get you to verify for me your name and date of birth? Perfect. So, do you have any idea on what you think your skin type is? Like sensitive, dry, oily, combination? Okay. Okay. When you wash your face, even just putting water on your skin, do you often experience redness in response? Okay. So, generally we would classify that as having sensitive skin. I am the same way. I can just get my face wet with water and it is already bright red. So, that being said, do you use an SPF sunscreen? Okay, that's really important. Do you know the strength? Okay. So then, can you tell me, do you have an idea about how much water you drink per day? Okay, that's good. Hydration definitely plays a part, especially with scalp health, actually. Okay. What current products are you using? Okay. Do you know the brand of that? And how often are you using a moisturizer? Okay. Do you use any serums with that, or? Okay, that's something we can talk about as we go. So then, are you exfoliating? How often? Okay. It would be wise to cut down to at the most twice per week. Cell turnover does help with the brightness of our skin, how soft or moisturized it can appear by getting those dead cells out of the way, but over exfoliating can be damaging and can actually counter the positive results we would be seeing if you cut it back just a bit. Okay. Do you have any allergies? Not just to medication, it can be to food as well. Okay. And my last question for now is, what are your main skin concerns that you have? Okay. Yeah, I can see that along your jawline. That's a really common place for breakouts. And then I don't see anything on your forehead. Do you use products in your hair? Okay, Yeah, that can definitely cause acne along the hairline. But I'm not seeing an active breakout at this time. So, if in fact you are having a major breakout of cystic acne, we can get you into our med spa at that time to help take care of it. I can also prescribe you a medication to help. Oops. Okay, so I think for now that is enough information for us to get started. I'm just gonna put this out of the way here. Put on some gloves. How did you hear about our clinic? Okay, yeah, I know her. Well, we appreciate the referral. Okay, so I'm going to come a bit closer, and I'm actually going to put on some magnifying glasses so that way I can see your skin more clearly. Is it okay with you if I touch your face? Thank you. Definitely helps me to be able to see what the skin elasticity and pores are like when I can just kind of lightly stretch the skin. So, okay. Just gonna be lightly stretching just like that. Skin does have good elasticity here. check. Now I'm just looking at your pores. So I do see some enlarged pores between the eyebrows here. And then your nose. Around your cheeks. And then your chin. I'm gonna grab my diagram here. So I have here this little face and these arrows. Don't worry about them, they're to basically demonstrate lymphatic massage. But I'm going to be using this to mark areas of dryness and oiliness. So blue for oily, pink for dry. Okay, so sort of like mapping your face, if you will. It's okay. Looks to me like we have dryness on the forehead. Would you agree? We're gonna circle that area. Okay. And then it looks like it also extends down the bridge of the nose. And I would say the chin as well. Okay. But then looking at your cheeks, as well as the lower portion of the nose, the upper lip, and the jawline on the sides. Those are more oily regions. Okay. So, based on what I'm able to see, do you feel like this map here, this is accurate? Yeah, okay. I'm gonna transcribe that in just a moment and remove my glasses. I wanted to take my hair with them. Okay, so now I'm just going to be taking a look at your neck and décolleté area, okay? Because this region of skin is the same as the skin on our face. you feel like you have issues with these areas of the skin? Okay. I do see some skin tags here, which are common. They form due to friction. Whether that be from the collar of your shirt or folds in the skin from sitting or lying down and reading. I do that a lot. Okay. I think I have a pretty good idea here. Just gonna draw our map here real quick. Forehead, upper portion of the nose, dry. The chin as well. And then the lower part, upper lip and cheeks. Higher oil production. Okay. So that you also stated that you are having some concerns about formation of some fine lines around your eyes. Just take a look. Yeah, I see those, but they're not deep or overly pronounced. And they're your smile lines. It means that you smile and laugh frequently. These can be minimized in appearance by a good skincare routine with frequent moisturizing hyaluronic acid to help moisturize as well. And I do see some under the eyes. Don't have deep 11s, what we call the lines between the brows. I have them due to concentration phases. No major nasolabial lines here. If it is really bothering you, we can also do a few units of Botox to paralyze the muscles to keep them from allowing your skin to create these lines. But Botox for this purpose is elective, so it wouldn't be out of pocket. You can think about it. It's not something that we have to do today unless you really want to. Okay. Well, if you'd like to do that, I can go ahead and get that drawn up for you. Okay. Give me 1 second here. Okay. me sort of recap that. Okay. So then let's clean off the areas where we're gonna go. Let's grab one more. There's a fluff floating through the air. Okay. Alright, the other side. So, I'm thinking we're going to be using about 6 units total. I'm going to be placing 3 on this side, above and below the eye line. Same with the other side, because these lines aren't terribly deep. So, I don't think we need a whole lot to start. I also believe it's better to begin with fewer, and then if you decide you need more over time, we can adjust, okay? So what you can expect is it's going to take, for the first time, a few days to actually paralyze the muscles. And it may not be all of them at once. It may be some of them begin to, and you kind of feel a little funny when you smile, for example, and then after a few days, you'll find that it's more difficult. With this placement, it might be a little difficult to squint your eyes, like if you go outside and it's bright, so good idea to always have sunglasses with you. Okay. Other side effects that you can potentially expect is just a little bit of redness around the injection sites, but that will fade. Okay. So, this is a very tiny needle. Okay, so you're not going to feel it very much. So, okay, I'm going to start on the right. Just like so. Doing great. Now I'm going to do the other side. All done. And just very lightly, just going to rub that in just a little. So, how was that? Was that okay? It does feel a little bit weird, but that should pass. now that we've addressed that, let's address some of your skin concerns. So with the dryness on your forehead and the bridge of your nose, we can try a peptide mask, which is also going to be a very gentle exfoliation. Okay? And while that is cooking, I can do some extractions along your jawline here and take care of some of this acne. That sound okay? Okay. Oh, it's good. No, it'll be fine on top of the injection sites. Those are tiny and they tend to heal up very quickly. So, this is our mask here. And it has like an apple scent. It's nice, yeah? So, let's grab a brush. And this is gentle, there's no sting to it. It shouldn't even tingle. So, just to start your forehead. I'm going to go down your nose. And let that sit. to exfoliate here, or not to exfoliate, to extract here. I'm gonna clean, but first I want to open your pores. So let me grab something. Just gonna use a hot pack. So. Got that one on the first try. Going to be holding this over your chin to warm and dilate the vessels, open the pores. Is this okay? It's not too warm? Okay, I can put another drape around it. Okay. Going to clean. And then they are curved, so I can press around the site, like so, to express anything inside. So it's going to be a bit uncomfortable, but we'll do our best to go quickly. Okay? Okay. So start with this spot right here. Okay. Gotta express everything. So that way it doesn't have any bacteria left to inflame. You're doing great. Sure we didn't miss anything. Looks like we got one more right here. Looks like we got everything. So now I'm gonna go through and clean the mask off, okay? Okay. Down your nose here. Okay, you need to close your eyes for me for just a sec. How are we looking here? Okay. Looking good. Looks like we got everything off. Okay. So now I'm just going to apply some soothing serum to the skin, which is going to help relieve some of the irritation because it's quite red in response to the exfoliation, the extraction, as well as just contact. So this is going to help calm the skin a bit. Okay. So gloves off because they are goopy. So, how does your skin feel right now? Feel okay? Okay, good, good. It's not stinging or burning or anything like that with the serum? Okay, good. Just wanted to make sure to rule that out. Sometimes with sensitive skin, even with soothing product, it can still trigger a reaction. So I'd like to make sure that that's not the case. And if it is a good insight into how your skin behaves. So taking a quick note. So, because this is our first time getting to know each other, and it's my first time getting to know your skin and its behavior in particular, I'm not going to prescribe anything yet. Instead, what I'm going to do is after 2 days, I'm going to give you a call and check in with you and see how your skin is doing, particularly in terms of how we exfoliated it, if you're seeing an increase of dryness or oil production, sensitivity, redness, anything like that, okay? And then once I have that information, we'll come up with a game plan for taking care of your skin. But because I don't know how your skin is going to react just yet, I want to wait until I have that information before coming up with any sort of official plan for you. How does that sound? Is that okay? Okay. If you do have any reactions, especially with the injections on around your forehead, then I want you to give me a call and let me know right away. Okay? Okay. Do you have any questions for me? Okay. If you think of anything, feel free to give me a call, okay? It was really nice to meet you. We'll talk soon.